I think it's really important to have discussions, debates, and most of all, critical thinking. And I like to use more than science research and what all the papers and data says, because we all know that it can always be biased. But I try to get us to have critical thinking and the common sense to think about things that are being offered to us or recommended to us as the best in practice. And so today's conversation, while it's controversial, I hope it doesn't get censored, but I hope it gives you things to think about. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition, and I have a private practice where we focus on root cause healing, and it often starts with the Carnivore Cures All Meat Elimination Protocol. Today I had the pleasure of sitting down with Dr. Peter McCullough. If you have not heard of him, he was an outspoken doctor about the real data that was being shared, and then when the mRNA vaccines came out. If you don't know Dr. McCullough, he is actually one of the most published doctors in his field of work. You'll see in this interview, I did not give him a single question, and he was able to cite so many different studies. It's amazing how much he goes by the research and data to share his thoughts. Additionally, he also has a private practice, so he gets to see the one-on-ones that are really being impacted or supported through a lot of the medical interventions that are being shared. So I'm going to get to the punchline, but before you call me an anti-vaxxer, I really just had questions. I had my children fully vaccinated. I also was fully vaccinated as a child. I even got the flu vaccines even while pregnant. And now I just wonder, with working with the chronically ill, where some patients tell me that their child or they themselves have been injured by a vaccine, at a certain point, you have to wonder, could there be validity with that? Or could there be truth in these vaccines where it can injure some people? I am just asking questions because there's a lot of things that come up to mind and we are not allowed to share it. And that's another thing. Why? Why can't we ask questions about the efficacy of things? We ask the safety of schools we go to or the protocols we take. But why can't we question anything that is mandated or recommended to the general public? I think there is cause for concern there. And so when I started doing the research on COVID vaccines and started looking at the data on all vaccines and then child death in the countries that give the most vaccines, I had questions. It may not be total proof of causation, but there is absolutely a correlation. And I will cite all the information in the show notes, but I just hope that you listen to this conversation as a place for discussion, for critical thinking, and then you ultimately make the decision that makes sense for you. There is no one size fits answer with medicines, with vaccines. And I hope that this conversation just opens your eyes or allows you to think what is best for me and for my loved ones. Let's get right into the interview. Hi, Dr. McCullough. I am super honored to spend this time and interview you. I've never been somebody to really follow status quo. And I think as I got sick from standard care, that even changed even more. And I think during COVID, I started questioning a lot of things. And your voice was one of the main people I listened to. And we have a private practice. And so a lot of the recommendations you gave as alternative treatments, especially for the chronically ill that are immunocompromised, I think you saved a lot of lives. So first of all, I just wanted to thank you for all the work that you do.
Thank you. It's so great to join you on the show.
Yeah. So for the people that may not have heard of you, I don't think there's many, but if you can introduce yourself and share how you're one of the most published doctors.
Oh, sure. So I'm Dr. Peter McCullough. I'm in practice as an internist and cardiologist. I'm trained as a research epidemiologist. I'm based in Dallas, Texas. I'm also the chief scientific officer for the Wellness Company, a nationwide alternative health platform. I'm the president of the McCullough Foundation. I've previously been a professor of medicine. I'm the editor of a major cardiology journal currently. And so I spend my time in part in practice, like today, part was practice, and then part in scholarship and the media. Previously, before COVID, I was focusing on the interface between heart and kidney disease, more chronic illness. And then I shift my focus to infectious diseases and the SARS-CoV-2 outbreak, the COVID-19 pandemic, vaccine safety. So the last 5 years has been a big academic shift for me, but it's been very rewarding. I wouldn't do it any other way than, shift my focus to the biggest health problem that we faced in our generation.
Thank you. And I will talk about COVID in a second, but I definitely want to talk about some of the bigger topics going on. There's this bird flu going around. How much do we have to be concerned? And is that the reason for the egg prices actually going up?
Bird flu has been around for well over 100 years in recorded history. Lysette and colleagues documented that in a UK summary. We're in the middle of a 4-year outbreak, and this is the original strain is called clade 23446. The subtype, the genotype that was dominant for the first 4 years of it was B3.13, very mild, pink eye in humans, mild illness in animals. The unique part of this bird flu is that it quickly spread to mammals, from birds to mammals. Now it's spreading between 40 different mammalian species. So it's mammal to mammal spread. And probably the single greatest development is the observation that there now are severe cases in humans, D1.1 variant. So a teenager in Alberta nearly dies. She goes on the ventilator, needs ECMO, survives. A man in Louisiana dies. Toddler and a man in Cambodia die. And so we have a situation where bird flu hasn't stopped. Now, normally it would burn out in a couple of years because the birds and animals will get natural immunity. Here, what's propagating it is the USDA policy of culling. It's called biosecurity measures, where they do pooled samples on farms. They don't know which bird is positive, but when they find a positive bird, they order the USDA and, of course, the big companies and ag directors order mass destruction of the entire flock. And this happens routinely now. So a facility is shut down for about 3 months, and then a fresh flock is repopulated. Then it gets reinfected by migratory waterfowl. They continue to spread the virus. And so then the facility is shut down again. And so this is taking a lot of egg-laying hens offline. Now, egg-laying hen will live several years, but if they keep destroying them, and the vast majority are healthy, it's a tiny fraction that actually have bird flu, it's driven the price of eggs up. The chicken has not gone up so much because those are meat hens, and so they live a much shorter period of time. This destruction, repopulation is not influencing that much. But the bottom line is bird flu has taken a turn for the worse. Mankind has made it worse. And if we simply would have no intervention, this would burn out on its own.
What I'm hearing from you is maybe if they didn't kill off all of those flocks, there would naturally be herd immunity in a sense with these birds, and then maybe the egg prices would go down.
That's right. So it's a senseless policy because it's not as if bird flu can be eradicated because it's in the mallard ducks and geese and migratory waterfowl. So they continually reinfect the farms. So the farms cannot be sterilized of bird flu. So biosecurity, as it's been carried out by the USDA, is completely fruitless. In fact, it's endangering the workers. In a paper by Garg and colleagues, all the workers who got bird flu, actually, who got the conjunctivitis, they got it during the process of culling. The poor workers who got ordered to foam all the birds or incinerate them, that's when they contracted bird flu.
The next big topic is measles. I have a lot of thoughts about vaccinations in general, but there was somebody that died in Texas, and I think there was someone in New Mexico. So the question is, and let me just give you a little bit background of my practice. So I work with the most immunocompromised. So they go on a carnivore elimination diet because they're so unwell that even any standard care has not helped enough. They'll go through all doctors, big name hospitals, and get diagnosed with unknown autoimmune. And so they have to find, I guess, interventions that work for them that is outside of standard care. And so carnivore sometimes can help that with the reduction of inflammation. So this same population then sort of gets scared of taking excess vaccines because, say, maybe their child has or allegedly has been impacted by the MMR vaccine, and now they've had other friends that say that they have autism now because of the MMR. There are other countries such as Japan and Sweden that don't combine all of those, the measles, mumps, and rubella together. And so they'll separate mumps because there's a risk of, I think it's meningitis. And then lastly, there's other countries that will just give measles vaccines when there's a spread if it's needed. So I know that there's been in the news lately that everyone needs to get the vaccine because there's a population that's not getting it. And that's why now it's coming around and killing people. What are your thoughts?
There was a Cochrane review in 2020, published in 2021, on the efficacy of the measles vaccine. And the overall theoretical vaccine efficacy is about 95%. But that's theoretical. I mean, you may not ever come in contact with measles. That's theoretical. Now, once we get down to people who have been exposed or challenged, that efficacy drops to about 75% or so. So the measles vaccine isn't perfect. In a review by Bianchi and colleagues, it was interesting. They studied medical students who either took the vaccines when they were young or they got natural measles. And those who took the vaccines, about 20% of them had no serologic protection, at least by that measure. And those who had natural measles, it was about 6% who didn't have protection. So I can tell you, when I was 2 years old, I took the measles vaccine, just the singular vaccine. When I entered medical school, age 20, I had no protection. There were no antibodies. So I took another measles vaccine. And then when I was a fellow, it was checked again when I was 28. There still was no serology. So I ended up taking two MMRs, way after the fact. I already had mumps as a kid. It was completely, the mumps part of it was unnecessary, as well as rubella. The measles vaccine isn't perfect. In the current set of cases that now involve 15 states, we're over 300 cases. But, in some years, in 2019, there was 1,200 cases. So there's going to be cases in the United States. The vaccine isn't perfect. And our CDC is not leveling with us. They're saying that 95% of cases are unvaccinated or vaccine status unknown. Well, if the public health message is to take a vaccine, they ought to know who took a vaccine and who didn't. I have a feeling that unknown is someone who thinks they were vaccinated, but they can't prove it with their vaccine records. So probably far more people with measles took the shot than didn't. But measles in general should be very mild. Now, the best paper to quote on that is by Miller, 1963 in the UK, where they had 59,000 confirmed cases of measles. 1963. Okay, so this is a lot of cases. So this is before modern ICU care. The rate of death was 0.2 per thousand. 0.2 per thousand. The hospitalization rate was 1.2%. So, if we have 300 cases right now, and there's already been one death of a school-age girl, the question I have is, what did she really have? Did she have co-infection with another illness? Did she get adequate treatment? The WHO has a vitamin A protocol. They're supposed to get liquid vitamin A. They're supposed to get IM or IV, IG, steroid nebulizers. There's cases on my Substack on Focal Points. I put out nice measles pneumonitis resolution with steroids. And so the CDC is not telling us how this, poor girl died and why did she die. The second death seems a bit more clear. It's an unvaccinated man. He's about 60. He starts with the rash going from head to toe. And then he actually suffers what appears to be a myocardial infarction. He's in the hospital for a day or day and a half, and then he dies. So that may just be, an infection-triggered acute MI, which we see in influenza, COVID-19. It probably won't be counted as a measles death, but still 1 in 300 seems high. My great concern is that there may be, unfortunately, pejorative treatment being given or nihilistic treatment. People may say, listen, you didn't take the vaccine, you don't deserve treatment, or you didn't take the vaccine and we don't want to see you in our clinic or our urgent care or hospital. It could be right back to where we are with COVID.
Wow. When I think of the big picture of vaccines, and I like to use a lot of common sense, obviously Reagan in 1986 or around that time, he creates the law to protect manufacturers for vaccines because I think that DTP, which is now DTaP, but it's because there was a subset of people that was so sure that the vaccine was injuring them. And so then Reagan puts in this protection so that the manufacturers can do whatever they want and not get fined for it. But there is a subset then, for some reason, that may get injured by vaccines. And if we think about if a lot of this herd immunity is to protect the immunocompromised, but maybe they are the ones that cannot take the vaccines because say that they can't detox it well, or their body is not strong enough, or their immune system is not strong enough to go through the whole, the process or the life cycle of the vaccine. So then if we say, fine, so then maybe the immunocompromised can't take it because of all of the risks and comorbidities. So then we say, fine, so then it's just for the healthy people that then are protecting the immunocompromised. And then it just makes me think, well, then what is the benefit of, I'm not saying all vaccines. So then with this measles one, if there is risk for the immunocompromised, how do we know that that guy truly just died because of measles?
Well, he'll need to undergo case adjudication, but what's described, it probably won't go down as a measles death. But you bring some very good points. Even our CDC says not everybody should get the MMR. The immunocompromised should not get it. So let's say a child has severe asthma and is on prednisone, should not be getting an MMR vaccine. A child who's had an organ transplant on, let's say, mycophenolate and prednisone or other immunosuppressive drugs. And one of the things our CDC is not telling us, and our public health agencies, is how did the outbreak start? If there's no measles in the community, where did it come from? Did it come from an outsider, maybe a migrant who had measles, or did it come from an immunocompromised child who is inappropriately MMR vaccinated?
But it just goes back to the thought of, so if the immunocompromised who were essentially almost trying to protect with these vaccines, so then are we saying that it's just for the healthy and then the healthy get it? And I mean, who knows how many people are really defined in healthy in the US now? But it just makes me go back to, if the government knew that the DTP was hurting some people and that's why they put the protection. So is that a common understanding that then there's a subset that will always get hurt and the government will just help?
Well, it's written into the law, the 1986 Vaccine Injury Compensation Act. It says in the law, vaccines have unavoidable harms. So that means, yes, some people will always be injured. With the MMR vaccine over the last 20 years in the US CDC Vaccine Adverse Event Reporting System, each year there's about 5 to 10 deaths due to the vaccine. So, this year we're going to have a measles death, which is the first one we've had in a few years in Texas, in Lubbock, Texas. But this year there will be more deaths after the MMR vaccine than measles.
So I'm a parent, and never once did my pediatrician tell me that there are risks. So say, for example, in flu shots, as an example, sometimes they have egg whites in the vaccine. And I know they say, I think the CDC says that is if you have an egg sensitivity, just stay in the room after you get vaccinated. It's still safe, but just stay in the room just in case. But do they even know those nuances? So for example, my pediatrician for sure does not know if my son has a egg sensitivity or not. And it's all of these caveats or nuances that are they sharing that to then make sure that maybe the specific immunocompromised children or the person getting the vaccine then isn't getting it.
Well, think about this. Let's say there's a serious egg allergy and there's anaphylaxis. That means there's going to be a cardiopulmonary arrest. And whatever you're vaccinating for is not as risky as that cardiopulmonary arrest. So if we take a normal child, then the vaccine poses more risk. Let's say if there is a polyethylene glycol allergy or polysorbate 80 or these acute reactions, it's frightening. Now, the combination vaccines we think is really where the trouble is. So once you put 3 vaccines together, diphtheria, tetanus, acellular pertussis, or measles, mumps, and rubella. Now the V is added, the varicella or the chickenpox vaccine. That's like giving 4 drugs at once. So there's going to be 4 times the side effect rates, and it would be impossible to figure out which one of the components. The polio vaccine is going to be added in, so it's going to be a 5th one. So I agree with the countries that do it one by one, so you can sort out and see which one is potentially causing side effects. So a couple principles. The vaccines are much safer given separately. The other principle is they're much safer given later in life. Every circumstance, if we can actually just give them later in life, this critical developmental period from age 6 months to about 4 years seems to be high risk. And for instance, when there's a febrile seizure that occurs, a paper by Nichols and colleagues from Europe shows there's about a 40% chance there'll be a conversion to autism. And febrile seizures occur after vaccination. Vaccination is not the leading cause of febrile seizures, but that's a high conversion rate, no matter what the source of the febrile seizure. The other thing is a paper by Miller demonstrated that, about 75% of sudden infant death syndrome occurs within a week of a big battery of shots around 15 months of age, 12 to 15 months of age, and half of them occur within 48 hours. So if you're a parent, you're going in for that 1 year of 15-month battery, and they do get, I counted up, there's 16 different things given. I counted up the schedule. It's 16. Well, listen, you better watch that child very carefully that night. If there's going to be SIDS or sudden infant death, it's going to happen that night or the next night.
They didn't have such a thing called SIDS so I'm in my early 40s, and they didn't have that when I was at my age as an infant. So it's just, what causes all of a sudden the SIDS if, medicine is evolving, what is causing it. And it is worrisome. That is the peak age, I think, is between 15 and 18 months, that in our practice that we have moms that swear that it's that round of shots that something has happened to their children.
Yeah, the other thing we never had as kids, I remember, we used to eat peanut butter and jelly sandwiches. Now peanut allergies are so common, you can't even, have peanuts in elementary school. They took peanuts off airplanes because peanuts and food allergies are skyrocketing. And there is trace peanut oil in some of the vaccines. Clearly, skyrocketing rates of asthma, atopic dermatitis, those are immune system problems. What's the thing that's really disturbing the immune system during childhood? These massive batteries of vaccines. And then the greatest concern are the neuropsychiatric disorders. Now here, we're talking about attention deficit disorder, Asperger's disorder, autism spectrum disorder, tics, and seizures. Now, all of those are on the way up, very tightly related to the development of febrile seizure, what we call a reactogenic episode after taking a battery of vaccines. For autism, the cause of autism is unknown, but when I was a child, it was 1 in 10,000. Now it's 1 in 36. The epidemiology says children born prematurely before 37 weeks, okay, that's a risk factor. Older parents, risk factor. Siblings with autism is a risk factor. And now there's 5 studies showing that excessive vaccination, particularly the combination vaccines, look like they're a risk factor. They look like they're the trigger. And in those studies, children who go natural, no vaccines whatsoever, have much lower rates.
Yeah, I did this N=1 sort of, I did an Instagram story, and this was right before COVID. And so, you could sort of talk about these things more freely. And I just asked, just out of curiosity, how many of you have vaccinated your children? And do you have a child that you didn't vaccinate? And I think I got over 100 responses. And so many of them said, my child that didn't get vaccinated is the one that's healthier. And just, to be fully candid, both of my children are vaccinated because I didn't know. And thankfully, nothing has happened with them. So it's not like I was anti-vax. I just had a lot of questions once COVID happened, and then they were just pushing this vaccination. The other thing that I am concerned about vaccines is when they do the research about heavy metals, especially because they're adding thimerosal, which is like a mercury adjuvant, and they say it's safe at certain quantities. But when you're combining the drugs, then the quantities become in excess. Do you have thoughts about the heavy metals?
Almost all metals in the body are an opportunity for misadventures, from gold to silver, the molybdenum in these artificial hips if it leaks out, lithium, gadolinium, all of these make me concerned. The vaccines per shot have trace amounts. So for instance, I personally, and like you, I've taken all the vaccines. My kids took all the vaccines. I counted up. I had taken 69 vaccines, including 40 flu shots. The flu shots have aluminum, and, hopefully that's a trace amount and the body can detoxify and get it out of the body. But, it is disconcerting that we haven't seen any studies of cumulative toxicity, right? So there's toxicity per shot, but what about all the shots? Is there any study of people like me who took 40 flu shots? And it's not that I love flu shots. It's just that I was on, medical school and residency and fellowship, and I was on medical staff, and I was told, listen, you better take a flu shot. Otherwise, you're not going to be able to go on rounds the next day.
I researched a lot because my parents were in their 70s when the COVID vaccine came out, and I had this gut feeling of that they shouldn't get it, especially because it's, this new vaccine, or technically not even considered a vaccine by the definition back then. And so when I did the research, found stuff on the flu vaccine, and I think there was a subset. I think it was the people in the ages of 40 to 55 where the risk of getting the flu was actually far worse if you actually got the vaccine. And I'll cite the study in the show notes, but
Yeah.
the research I found was there was no net benefit at that age group, and all the other age groups, it was very slight.
Well, it's true with every intervention like vaccines. There are groups that are such high risk that even if the vaccines have very modest protection, it could be worth it. But someone like me and you, we're young and healthy. I just, went biking 10 miles before I got on the show here. Even if I got flu, and the chances, by the way, of us getting flu each year is way less than 1%.
Yeah.
But even if I got flu and you got flu, we'd get through it easily. So, I wouldn't need a flu shot. But let's say somebody with emphysema or heart failure, if they got influenza, that could be it. They could lose their life. A flu shot may make sense. So I'd love to see us get to risk stratification and then gender and age appropriate vaccines. So this is very important. I'll give you an easy one, and that's hepatitis B. So unless a mother is actively IV drug abusing or has hepatitis B, a child at birth gets no value out of getting a hepatitis B shot, none whatsoever. But if that child, approaches their teenage years, where they have sexual encounters or get tattoos or go into healthcare like us, then a hepatitis B shot makes sense much later on in life. There's been studies, by the way, of kids who go through the entire hepatitis B shot series, and they do get sexually active in their later teenage years, and they have no protection for hepatitis B. It's a complete waste of time. They'd be better off getting the series as they go into their teenage years. Babies are given the adult influenza shot. Well, it doesn't help them at all. I mean, when they become senior citizens, then an influenza shot makes difference. Here's a gender-specific one. A lot of people don't think about this. Little boys and men do not get significant rubella or German measles. We don't. It's like a drippy nose. You could never identify rubella in a man. It's only women, as they approach childbearing years, where they can get the congenital rubella syndrome in the baby. So we never should have been giving the R of MMR to boys or men at all, ever. And I remember when that came out, I was maybe 5 or 6 years old. There was a huge push to vaccinate everybody. I didn't question it. I was a little kid at the time, but I look back on it. I never should have taken the rubella shot because I'm a boy. I mean, I can't get congenital rubella syndrome.
But if you consider the Reagan policy that came into play, and that's 50%, essentially 50% of the population that you can now vaccinate, which makes more money, unfortunately, I just still have a hard time. So if we were to give vaccines at a later age in life because your maybe immune system is more developed, but if you are a healthy child, do you need these vaccines? And I guess we'll never really fully know unless we do studies. But it's just if my child is healthy and then we waited to get the vaccine, do they even need it? And if you say it's age specific, but we also know that if the age specific is oftentimes related to because the body is sicker or there's more immunocompromisation, but then maybe they shouldn't be getting it because of that too. So it's just this, I'm trying to wrap my head around.
Well, again, it's all about risk benefits. So you and I took all the vaccines, our kids took all the vaccines, and we're fine. We didn't have any side effects. Thank goodness. We'd probably have a different viewpoint if we had autism or our kids had autism, whatever. But there's no doubt. Right now, 5 studies. The most recent one is by Anthony Mawson that looked at 49,000 Medicaid recipients in Florida. And they used automated sources of data. The story was about 10% in that data set. These are Medicaid recipients, took no vaccines, 10%. Now, that's Medicaid encounters. I guess they could have gotten shots in school or something else that wasn't captured by Medicaid. But let's take it at face value. 10% didn't take shots, 90% did take shots. The 10% who didn't take shots, I mean, they had much lower rates of asthma, allergic dermatitis, tympanostomy tubes, urgent care encounters, lower rates of autism. But of interest, in the unvaccinated group, the autism wasn't zero. As I recall, I think it was 1.1%. And then in the vaccinated group, it was 2.9%. And that's a big difference. It was a huge sample size. So the studies that have tried to evaluate autism, for instance, and vaccines have never gotten a clean control group. Even this Madsen study from Denmark, where they said, oh, these people are unvaccinated. Later on, doctors said, well, we gave them vaccines. We just never documented it. So we haven't had that clean group. And traditionally, 2.5% of Americans don't take vaccines forever and ever and ever. So Amish, Mennonites, Quakers, and others. That number now, since COVID, has risen to about 10%. And there's some parents out there now that are adamant their kids are not taking shots. And I know a lot of them. You probably do too. So we're going to have a big control group. It is my experience that, again, the kids who take no shots tend to be very healthy. And it may be selection bias. Maybe kids with cystic fibrosis and others, end up taking shots. But everything we know now, so it's Hooker, Miller, Mawson, Thomas, in the Amish study. There's 5 studies now, safer to go natural.
This is not me asking you as the expert, the researcher, but just as a father, if you could do it again, knowing everything you know now, would you give it to your children?
Yeah, if I was a young parent right now, I would focus on these principles of, is the child healthy? Let's assume healthy, and that later is safer. So I would decline all the vaccines initially, and then I would see, as things shake out. So I think the most compelling vaccine is the single polio shot, the IPV. Okay. If you look at that singular shot, it almost has no side effects. And boy, I have patients in my practice with polio that contracted it. And if your child contracted polio, you'd feel terrible. Now, the good news is CDC's got a polio water surveillance system. Polio is not in the water. If you stay in the United States, there is essentially zero chance your child's going to get polio. But if you travel, let's say you go on a trip with your baby to Central America or to the Caribbean or to Europe or Asia, things are different. I think polio, a little bit later in that risk window, and I think the risks for everything really go down after age 4, and certainly way down after age 8. I would look at that. So I had a patient today. He's a young man, and he's going to have a daughter born, and he lives in New York State. And he asked the same question: what do I do with my child? Because in New York State, there's just no way to get exemptions. And I said, this, you could at least delay to after age 4, and then work on some type of selective catch-up program. I think it's going to be a lot safer if parents wait.
What's interesting is, so I never heard of the Gardasil vaccine because I didn't get it. It wasn't out when I was at the age that people get it. We have a handful of people in our practice that swears when I got that shot. And so my boys are not at the age to get that shot yet. And so now I'm just concerned about possibly getting that. And we see there's just been enough people saying, I can say that when I got that shot, because I needed to go to high school or college, it has changed my life for the worse.
What type of syndrome have you observed after the child gets Gardasil?
I think the overall is just the immune suppression. So just there are chronic illness symptoms that now are never going away. So, they're just more sensitive. So they might get sicker quicker, but in general, they become a chronic illness community member.
I've had some parents take me to see their children who did take the Gardasil vaccine, and they had a catastrophic change. Okay. And what's been notable to me is a multiple sclerosis-like syndrome. So the parent will show me a video of the child at age 14, playing volleyball and running and perfectly normal. They take the Gardasil shot at like 15 or 16. And by age 17, they're in a wheelchair, spastic, contorted, voices changed. It's like a rapid onset multiple sclerosis syndrome. I've seen several of them now. It's frightening. I reviewed the data on Gardasil, and it's a vaccine that's failing pretty rapidly because there's so many different strains of human papillomavirus now. The group that needs Gardasil the most in terms of risk are gay and bisexual men.
Okay.
By far, way more than heterosexual context. So kind of normal, girls and boys in suburban America. I mean, it's not a very good value proposition. Now, someone in the gay or bisexual group, but I've looked at the data, it's less than 50% protective from human papillomas, genital condylomas, anal cancers. It's not that good.
That's so interesting that you say it's for that community, because the number one advertising I see is for young girls. And then now it's towards young men. So, okay.
I mean, that's my perspective. It's just like hepatitis B. Every child born in America gets it on day one, on their first day of life. And who really needs it is people like you and me as we go into healthcare, and we're going to work with needles. So again, I think we can narrow vaccination based on risk stratification, age, and gender, and give far fewer vaccines and have the program be more appropriate and safer. But right now, if we give every single child the same battery of shots, and that's a huge number of people, there will be enough side effects to get our attention.
What's interesting is I did a chart on all the countries that give vaccines and their schedule, and US, I think it was the UK and Australia and Canada were the heavy hitters. And they also there was a correlation. I know it doesn't mean causation, but there was a correlation where they also had the most infant deaths. So it's just something that was very fascinating to see. We obviously see a uptick in autism, autoimmunity. Do you think it's a big portion is vaccines, or do you think it's just our modern world is so toxic? What is causing all of these new illnesses and chronic illnesses to proliferate? And then what can we do to support our natural immunity, even if we were not sort of born a little immunocompromised?
We need a giant Framingham-like study of children. We need a giant, like the cardiovascular health study or Framingham Heart, but we need it for children. So I'm talking about 50 to 100,000 children who parents enroll them, at birth, and they get careful samples, and ostensibly the children are normal at birth, and then we evaluate for incident diseases. As I've already said, the cause of autism is unknown, but the CDC says it's far and away the biggest childhood disease of concern. I mean, 1 in 36 and growing. I mean, we're looking at 2 to 3% of the population now who basically have neurodevelopmental problems, neuropsychiatric problems. And some cases of autism, they're very highly functioning and very intelligent. And then others are, completely dependent on the care of their parents the rest of their lives. So, I mean, this is not a trivial thing. When you and I were kids, it was very, very rare, and now it's very common. So when I give a big public program, I ask for a show of hands. I say, how many of you know somebody in your circle that's been touched by autism? It's about 25% of the crowd raises their hands. So this is a very, very big deal. And we should have an all hands on deck epidemiologic study to study all these factors. And it's going to be just like coronary atherosclerosis. I guarantee it. There's no single cause of heart blockages, but there are risk factors.
Sure.
So in heart disease, we accept cholesterol, diabetes, hypertension, smoking, family history. For autism, it's going to be the same thing. We'll end up with risk factors, probably premature birth, older parents, siblings with autism. Chances are there's going to be a relationship to vaccines or proclivity to febrile seizures or other childhood illnesses. Whatever it is in children, it happens between the ages of 2 to 4. And they take a dramatic change. The children are not born with autism. This is very important. So it's something, again, an epidemiologic study can zero in on what happens during this time frame that's related. Now, autism is very interesting because it's neuropsychiatric. So the neuro part of it is there are bona fide hearing changes. So there's hyperacusis. Have you ever seen autistic kids wearing headphones? There's hyperacusis. There's also an auditory processing. So a lot of times there's an elevated kind of machine-like voice, like Dustin Hoffman and Rayman saying, well, I have autism, that type of thing. It's because this neurologic processing is not the same. Autistic kids have the hardest time looking the parents in the eyes.
Right.
looking and just engaging. They're always looking off. It's the hardest thing. So those are characteristic features of autism. And then, of course, the psychiatric. And this ostracism is high, very high rates of LGBT, so gender ambiguity, gender dysphoria, transgender. That's part of this autistic package.
Everything you brought up doesn't even consider the fact that whenever there's a autistic child in a family, there's a higher chance of divorce because it becomes so hard on the family. So there's bigger ramifications. And do you think that they'll start doing these big studies to figure out what's going on? Do you think RFK may, start bringing stuff like this in?
Well, recently the CDC and HHS said they wanted to have, epidemiologic study to figure out the determinants of autism. But Senator Bill Cassidy, who's an older GI doctor in the Senate, he said, absolutely positively, we shouldn't spend a single dollar investigating vaccines and autism. And I thought to myself, boy, we've just seen report after report where there's a massive waste of money on research, transgender research in laboratory rats and ridiculous research study, hundreds of millions, if not billions of dollars blown out there. And yet autism, which is the number one childhood disease, there's not a single large-scale conclusive study. All the studies are very meager. There's almost no studies of therapies whatsoever. And parents are scrambling. They're trying different diets and looking at this gut-brain axis. And autism should be the best funded and most heavily studied childhood area. You can't, I looked at studies of probiotics, and there's just a handful of children studied here and there. There's almost no research for autism.
This goes back to my common sense logic. It's just, okay, so they're willing to do studies on so many things when there might be some result that comes out of it. But when autism is undeniably growing, why aren't they willing to do the research unless they know that they're hiding something? Because that's the only logical thing I could think of.
Or they're afraid of what they find. Can you imagine the deep guilt that people are going to have when they realize, oh my gosh, we did this to ourselves? There's a great video clip, 1964, when Luther Terry called all the chiefs of medicine and the public health officials into Washington, and he revealed the Surgeon General report on smoking, 1964. You should see the look on these faces. And they're like, oh my gosh, we did this to ourselves. This whole lung cancer epidemic was all caused by our smoking. And doctors smoked. They promoted smoking. Families smoked. It's going to be the same thing. I think the reason why people don't want to study it is they're really afraid of what's going to be found. Recently, Dave Weldon, internist from Florida, his nomination was just sunk. And I think the reason why it was sunk is that Cassidy and Hassan and Bernie Sanders and others, they actually are incredibly fearful of a public discussion on this problem. Can you imagine if someone like me in the Senate panel just cited the data? I don't think they could actually bear to hear this type of conversation.
But the alternative is that more and more people are not trusting mainstream, and now through COVID, there's this, I think the reason why more and more people are not trusting beyond just the COVID vaccine is because of all of the distrust and the, censoring of information. So now people are going to the alternative news medias to basically get the information, because whether they choose or not to do these autism studies, I think other people will just share their stories, and it'll be enough and compelling enough to think there's this big, dark boogeyman that is not willing to tell us that autism is happening possibly with vaccines as one factor. And so then maybe more and more people will rebel against it anyway.
Well, that came up at the Senate confirmation hearing in the Jay Bhattacharya to lead the NIH. And again, Cassidy was asserting, vaccines do not cause autism. Vaccines, and we shouldn't spend it. Don't you agree? He is just asserting this. And Bhattacharya says, well, I've read the literature, and no, I don't think vaccines cause autism. He goes, so therefore, will you pledge that we won't spend a single dollar investigating vaccines and autism? And what Bhattacharya said, listen, he said, it's not going to make the concerns go away. He goes, people are concerned. good research would address their concerns. So in a sense, what are you afraid of?
Right.
And big epidemiologic studies, believe me, are going to capture vaccines. They're going to capture, dietary changes and, all kinds of things. And if the vaccines come out clean every time, then we're in great shape. Maybe it's something else. Maybe it's glycosphades or sugar or, cell phones or whatever it is. There's something going on. I know recognition is better for autism, but, I don't like this stance in Washington. I don't want a senator telling me we shouldn't research autism. That's not okay. The senators work for us. They're our employees. And no, I'm telling them as a senior doctor, we should investigate autism and vaccines because the best data right now suggest at the least a big battery of vaccines may be a trigger for this autistic conversion.
Right. And I always think that if there are families that are saying that their child got injured by whatever round of shots or a specific vaccine, to say that all of them are wrong or misled, that's where I think it's, well, why don't we just test it? Why don't we look at that population of people and maybe their immune system is responding differently to the vaccines than the other population that had no adverse effect. And then in that, you find the canaries in the coal mine and you can see where human immune systems may differ and how we can alter medicine, right, for this immunocompromised maybe to heal better. And
well,
that's
it may lead to diagnostic and therapeutic targets. So there are about 200 papers suggesting this autistic conversion is a kind of neuroimmune process. So I think you're on the right track. The immune system is essentially white blood cells, antibodies, complement, and cytokines. Cytokines readily pass the blood-brain barrier. And during these acute reactions to vaccines, and you know this because the kids get really sick, it's not only just febrile seizures, but also, they're kind of just are out of it neurologically for a period of time. And that's due to probably raging cytokines. I can't imagine, a little baby who's 15 months old getting 16 different immune stimulants at once. Yeah. I mean, it's absolutely stunning to think that a human body could sustain that. And so, I'm greatly concerned that the hubris over ever increasing mass vaccination has swept this giant safety concern. I mean, it's concern. It's basically a tidal wave of autism under the rug, and things are bubbling to the surface. You can tell that parents now are absolutely incensed about the lack of sensitivity to this. Recently, New England Journal of Medicine had a case vignette, and it was a child, and the child had taken all the vaccines. It was, I think, a 3 or 4 year old child, except for the MMR. And the family was afraid of the MMR autism connection. And the vignette asked the doctors, there was a poll, would you accept this child into your practice? Well, they had been vaccinated for Haemophilus influenza B and diphtheria, everything else except for measles, mumps, and rubella. And the answer was 36% of doctors said, no, I won't take him into my practice.
Wow. Yeah, it's concerning, especially because, and this is the last thing I'll say about the vaccines, and then we can move on to COVID, but just 40 years ago, when I got the shots, it was a fraction of what my child got. And again, I didn't know. And so I just blindly trusted my pediatrician. And thankfully, again, I mean, maybe there are some minor symptoms. Maybe my son occasionally will suffer from eczema, and who knows if there's any level of correlation. But my common sense, I just think, what has changed in 30, 40 years that my child had to get X-fold more vaccines and in a short period. And now there's SIDS and there's all these other illnesses that have never really been around. And that's just, to me, it's just concerning.
You're right. You're right. So that's a good point. So there is less diphtheria, tetanus, and pertussis. And people say, well, that's probably the vaccines. Right. But there's also less scarlet fever. Mm-hmm. There's also less rheumatic fever. There's less tuberculosis. We don't have vaccines for that. So our environment's gotten a lot better. Kids are not sleeping in the same bed. We have better food and water and hygiene. So, our infectious disease risks are down, and it's not due to the vaccines alone. And so, that's another point, to go natural right now. Again, the one I would be most fearful about is polio. We've got polio surveillance in the United States. Very good polio surveillance. That's the most compelling one. Remember, diphtheria and pertussis, we treat with azithromycin. Tetanus, we treat with antibiotics. If there, ever was a deep tissue wound anyway, prophylactic antibiotics. Haemophilus influenza B, treated with antibiotics. The other ones are self-limited, influenza, measles. These are all very self-limited. Is polio, you can't get that paralysis back. And then rubella, you can't get that congenital rubella syndrome baby back. That's it. I think those two are the big, most compelling ones. And fortunately, they can be taken later in life.
So if I were to summarize just a little bit of what we talked about in the vaccines, if I had a immunocompromised child, or maybe even if they were fully healthy, I would still sort of wait until maybe they're a little bit older, maybe past the age of 4, and then consider the rubella if they're female, and then consider polio. And then for all of the other illnesses, maybe we use other medications. But again, it's the parent's choice. And I just recommend that people do research. I already gave my children the vaccine, so I never had to look.
Okay, but you bring up a good point. You use the word immunocompromised. So when I think of immunocompromised, I think of a child who has, let's say, an immunoglobulin deficiency, like an IgG2 deficiency, or a child who's on a lot of steroids, maybe he's had a kidney transplant, or
well, I also define it as a child that maybe always gets earache, so they've already been on 10 rounds of antibiotics.
Right. Okay, but that still could be immunocompromised. But here's the point: if there's truly an immunocompromised child, remember the live attenuated vaccines are the ones you really get in trouble with. So a child can get very sick with an MMR vaccine. Let's say a child who has asthma and is on steroids, or the same thing with the chickenpox vaccine. So what I worry about is not necessarily immunocompromised children. I worry about children who are frail due to some medical problem. And if they got the infectious disease, it could be overwhelming. So a common one is cystic fibrosis. They're not immunocompromised, but boy, are they at risk for pneumonia because their secretions are not normal. Children who have tetralogy of Fallot, a congenital heart disease, diaphragmatic hernia, I worry about those. Again, not because they're immune compromised, but because there's a structural problem there, tissue problem there. Cystic fibrosis, congenital heart and lung disease, that may be enough to say, listen, just take the full vaccines. The benefits outweigh the risks. Immunocompromised, watch out for the live attenuated vaccines. And again, we can always treat with antibiotics. Healthy children, which is most common, there, almost in every circumstance, the risks outweigh the benefits early on. And I'm thinking almost anybody now can wait until after 4 years old. The World Council for Health says it's safer to wait now. So that's an international, evidence-based, physician-led, consensus-driven organization that says, listen, get off the routine schedule and just wait a little longer before you consider these.
Okay. No, that was good. That's a good summary. Let's talk about COVID real quick. I haven't been following the updates as closely anymore, but there was the conversation that COVID came out from a gain of function and it was a Wuhan leak. Is that the accepted stance, or is that still not 100%?
No, the lab leak is accepted now. Our CIA indicates that. The COVID House Select Committee that investigated indicates that. Report out of Germany this week also. And so all agree it is gain of function research. It came out of Wuhan. It's a joint U.S.-Chinese collaboration. And Anthony Fauci's been given a 10-year preemptive pardon for his role in this. I mean, that should tell you all you need to know. I'll say quickly, we're on our 5th year of the pandemic. It should have been over with in 2 years. I think what extended it is mass vaccination, because the vaccines are not sterilizing and the viruses learn to live in the vaccinated very easily and spread among the vaccinated. So people now get it over and over again. 97% of us have had it. It's very mild now, unless somebody has never had it. And our early treatment protocol, McCullough protocol, most widely used in the world, is still the go-to protocol. It starts with nasal sprays and gargles, which we should be doing twice a day anyway, getting fresh air, over-the-counter nutraceuticals and supplements, aspirin, oral antivirals, hydroxychloroquine, ivermectin, Paxlovid, molnupiravir, secondary antibiotics, azithromycin, doxycycline, corticosteroids, very important, colchicine, severe cases, antithrombotics. I haven't had to use antithrombotics in years, honestly. So early treatment for high risk, most people don't need it at all. Bigger concern we have is side effects that are still emerging after COVID-19 vaccine.
So do you recommend anyone to get the booster shots then, knowing all of what we
No, it turned out to be a disaster. So if we look at the virus, the vaccines are the genetic code for the spike protein. The spike protein is on the spine of the surface of the virus. This is the lethal part of the virus. This is what killed people. So to take Pfizer, Moderna, that is the genetic code for the lethal part of the virus. It's almost like Russian roulette. And, when I give large public programs now, I ask a question: how many of you know somebody who's been injured, disabled, or have died after COVID-19 vaccination? 85% of the audience raises their hand. So everyone knows it. And the only people who won't come out and discuss it are our leaders, President Biden, President Trump, our major leaders in Washington, our public health leaders. And the other major group that will not come out and admit this are the doctors. There's not a single chief of medicine in the United States or a single chief of infectious disease. We're right back at the same time with smoking. Smoking 1950, not a single doctor would express a concern. And it was so obvious. It was known that it was causing lung cancer. It wasn't until 1964 when finally we had a strong surgeon general that called everybody to Washington and said, listen, smoking causes lung cancer. I just wonder, is it going to take 20 or 30 years before we have that big meeting and call everybody in the room and say, listen, the vaccines cause heart damage, myocarditis, blood clots, neurologic problems, autoimmune problems, maybe even cancer. It's been a nightmare. I tell you right now, my entire practice is full of people who've been damaged by the vaccines.
The part that's confusing, and I spoke with Dr. Hazen about this, and a lot of her papers were getting retracted. So part of me thinks, okay, maybe they had a big mess up. And so the Wuhan lab, they knew that happened and they were like, oopsie, but they didn't want to share it with public because then it'll be chaos. So maybe that's why they were hiding it, like, oops, let's try to get this under control. Or, it was a little bit more nefarious where, okay, well, let's just come up with the vaccine, make a ton of money. How do you give pardon to Fauci when he hasn't been prosecuted fully yet, right? It's just, so I just, where is the line? Is it truly just, it was the whole process just to make money? Or is it just they made mistakes in their steps and then they didn't want to admit that they were wrong?
Well, this research, it would qualify as what's called pathogens of pandemic potential dual purpose. So dual purpose research is to create the organism, to create the virus, create it, and then create a countermeasure, which can be vaccines, monoclonal antibodies, or therapeutics. So, Fauci essentially has said this in some of his testimony. The whole purpose of the Wuhan lab was to get to the vaccine. That was to make the countermeasure. And so in many ways, this has been a grand experiment to see if we can get the whole world vaccinated with brand new genetic vaccines. And in fact, about 2/3 of the world took a COVID vaccine. Now, these, by and large are genetic. No one knows if the genetic material leaves the body at all. The spike protein has been found in the bloodstream now for well more than 6 months. The spike protein is found in blood clots. This had to be the worst idea ever.
And when you set fear and then you put a person that's like, hey, I have all the answers, we just have this thing where if we have fear, we're willing to sacrifice all our freedoms and our rights to have an answer where we no longer feel fear. So it was like a perfect storm. I just don't know how much of the storm was intentional. And it's just interesting.
I think fear was a huge component in everything we saw, from clinics being shut down, doctors not treating patients early, the suppression of early treatment. A lot of that was fear driven. No hospital or medical school ever developed an outpatient protocol. This is shocking. And then this relentless push for the vaccine, I think a lot of it was driven out of fear. And I've had very few doctors approach me privately and say that they now regret it. Very few. And a couple have been honest, said, listen, I took these, I had my kids take these, I have my patients, and I feel awful now. But if we have 1 million doctors, there's only about 500 that are leveling with the country right now. So, yeah, I took all the prior vaccines, but I feel fortunate. I had COVID early in 2020, and I didn't take the COVID vaccines. My wife didn't take the vaccines. So I feel grateful that we were spared this misery. But I do have great sympathy for people who took them. Anybody who took a vaccine, I think they should do something. The best data we have in the peer-reviewed literature is to undergo what's called base spike protein detoxification with nattokinase, bromelain, and curcumin. That's kind of my copyrighted approach. And then you can add other things to it. It's available through the Wellness Company as the ultimate spike detox. That's far and away the most common and popular thing to do right now. I'm still seeing people who took shots in 2021. They build up spike protein in the body, and then they develop a blood clot in 2025, or sadly have a cardiac arrest. And once people start detox, those things don't happen. I hope people get the message from this video. And thank you so much for having me on the program.
Yeah, thank you so much. So if people were to want to support your work and follow your work, where can they find you?
For support, go to McCullough Foundation, McCulloughFND.org. It's a leading not-for-profit foundation, tax-deductible donations, supports our work, funds our epidemiologic efforts, and our publications. I'm one of the most published people in COVID-19 in the world right now, and in the peer-reviewed literature. Also supports my testimony and work in the legal area. Focal Points. Everybody should sign up for Focal Points. It's the leading medical Substack now. Has critical late-breaking abstracts, everything you're going to need there. All the citations I gave today is on Focal Point. For the Saturday, Sunday podcast, America Out Loud Talk Radio, McCullough Report, I bring on guests, every week, give critical updates. That's every Saturday and Sunday, 2 p.m. Eastern. I also lead Pulse Wednesday afternoon at 5. And then very importantly, check out my book, Courage to Face COVID-19. That's a bestseller and probably be a major motion picture. I mean, just to describe what we've gone through. Right. And I never would have guessed I would have been on Joe Rogan and Tucker Carlson and testified in the Senate and became a public figure. The primetime TV stations still call me. And we're 5 years into this. And like you, I've been so busy. I've tried to help so many people. I've tried to be as true to the data as I possibly can. I don't want to bring people bad news, and neither do you. But we have to be honest and, above all, do no harm.
Right. No, exactly. Well, thank you so much for your time. Again, my parents, they were in their 70s. They are meat-based, but because of your protocols, I got them on ivermectin and all the other things that you mentioned, and they never got the shot. And I'm so thankful that they didn't. So thank you so much again for the work you do. You are truly changing people's lives.
Thank you. Bye-bye.
When I first looked into the COVID vaccine information, and then I started digging into some of the childhood vaccines, it just sort of happened. I saw one specifically for varicella or chickenpox. There was no varicella or chickenpox vaccine when I was young. And so I got chickenpox with my cousins and family and friends, and we all, put the calamine lotion on ourselves so that we wouldn't itch ourselves. And then we moved on with our lives. When I did the research for COVID, and again, I'll put my article in the show notes, but the number of people that die from the chickenpox illness is less than 100 a year. There are many more alleged vaccine injuries than 100. So I'm not saying that those 100 people's lives don't matter, but was that vaccine necessary? And there was one caveat that I also found. And again, both of my boys have the chickenpox vaccine, so they never got chickenpox. But there is a certain type of brain disease that if you had chickenpox, that you would never get that brain disease. Could it be that now my kids are at risk for that brain disease? Additionally, we see that shingles is more and more common. And if you think about it, if children had chickenpox, they would give the antibodies and keep exposing children or older children, teens and adults to small doses of the antibodies of chickenpox. And so essentially, they should never get shingles. So if you think about all of these things, the question is why? And I don't know. Could it be nefarious? Could it just be because it's a capitalistic market? I work with the most chronically ill, and so I'm just trying to find answers. If, like Dr. McCullough says, if we can make it age appropriate, timing spaced, maybe it will be a lot more safer than it is now. But I think the most important thing is that we have these discussions. Since being in the wellness space, I started with just carnivore or an ultimate elimination diet. And then I've learned whether it was mold illness or Lyme or MCAS or Epstein-Barr or other viral infections or other autoimmune, I've learned that it is better to hold strong beliefs loosely, meaning that the data can always change, that things can always change to say, okay, now there's new information. Now, when I started working with more people in our practice, we knew that carnivore alone was not the only answer. Doesn't mean that carnivore is not good, just means that there might be other things that we also need to look at. And so if we have strong convictions held loosely, we are open to being flexible and having open minds to challenge the narrative. We don't want to be dogmatic because science is always evolving. And so I hope that this conversation allows us to critically think. Okay, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.